Antisocial Personality Disorder, ASPD. Introduction. Antisocial Personality Disorder, ASPD, is a complex and often misunderstood mental health condition characterized by a pervasive pattern of disregard for, and violation of, the rights of others. This disorder manifests in various ways, including deceitfulness, impulsivity, irritability, aggression, disregard for the safety of oneself or others, consistent irresponsibility, and lack of remorse after harming others. The onset of these behaviors typically begins in childhood or early adolescence and continues into adulthood. ASPD is one of the most challenging personality disorders to treat, primarily due to the individual's lack of insight into their condition and their resistance to seeking help. Understanding the intricacies of ASPD involves delving into its diagnostic criteria, the underlying causes and risk factors, the social and personal consequences of the disorder, and the potential treatment and management strategies. Diagnostic criteria. The diagnosis of antisocial personality disorder is primarily based on the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. To be diagnosed with ASPD, an individual must meet the following criteria. 1. A pervasive pattern of disregard for and violation of the rights of others since age 15 years, as indicated by 3 or more of the following. Failure to conform to social norms with respect to lawful behaviors, as indicated by repeatedly performing acts that are grounds for arrest. Deceitfulness, as indicated by repeated lying, use of aliases, or conning others for personal profit or pleasure. Impulsivity or failure to plan ahead. Irritability and aggressiveness, as indicated by repeated physical fights or assaults. Reckless disregard for the safety of self or others. Consistent irresponsibility, as indicated by repeated failure to sustain consistent work behavior or honor financial obligations. Lack of remorse, as indicated by being indifferent to or rationalizing having hurt, mistreated, or stolen from another. 2. The individual is at least 18 years old. 3. There is evidence of conduct disorder with onset before age 15 years. 4. The occurrence of antisocial behavior is not exclusively during the course of schizophrenia or bipolar disorder. Causes and risk factors. The development of ASPD is influenced by a complex interplay of genetic, biological, environmental, and psychosocial factors. Understanding these causes and risk factors can provide insight into why some individuals develop this disorder while others do not. Genetic and biological factors. Research has shown that there is a genetic component to ASPD. Studies of twins and adopted children have demonstrated that genetic factors account for about half of the variance in antisocial behavior. Specific genetic markers, such as variations in the MAOA gene, often referred to as the warrior gene, have been associated with increased risk for aggressive and antisocial behavior. Neurological research has also highlighted differences in the brains of individuals with ASPD. For example, studies have found abnormalities in the prefrontal cortex, which is responsible for decision-making, impulse control, and social behavior. Additionally, differences in the amygdala, which plays a role in emotion regulation and fear response, have been noted. Environmental factors. Environmental influences, particularly during childhood, play a significant role in the development of ASPD. Key risk factors include childhood abuse and neglect. A history of physical, emotional, or sexual abuse or neglect is common among individuals with ASPD. Such traumatic experiences can disrupt normal emotional and social development. Family environment. Growing up in a dysfunctional family environment, where there is instability, violence, criminal behavior, or poor parenting, increases the risk of developing ASPD. Peer influence. Association with delinquent peers during childhood and adolescence can encourage antisocial behaviors. Socioeconomic factors. Poverty, lack of access to education, and exposure to crime in the community are also significant risk factors. Psychosocial factors. Psychosocial factors, including personality traits and early behavior problems, contribute to the development of ASPD. Children who exhibit conduct disorder, characterized by persistent patterns of behavior that violate social norms and the rights of others, are at higher risk for developing ASPD in adulthood. Consequences of ASPD. The impact of ASPD on individuals and society is profound. The disorder affects various aspects of life, including personal relationships, occupational functioning, and overall quality of life. Moreover, the antisocial behaviors associated with ASPD often lead to significant social and legal consequences. Personal relationships. Individuals with ASPD often struggle to maintain healthy relationships. Their tendency toward deceitfulness, manipulation, and lack of empathy can lead to conflict, mistrust, and instability in personal and family relationships. Partners, family members, and friends may find it challenging to cope with the individual's behavior, leading to frequent relationship breakdowns. Occupational functioning. The impulsivity, irresponsibility, and disregard for social norms characteristic of ASPD can hinder an individual's ability to maintain steady employment. Frequent job changes, conflicts with co-workers and supervisors, and involvement in unethical or illegal activities can result in chronic unemployment or underemployment. Legal issues. Individuals with ASPD are at increased risk of engaging in criminal behavior, which can lead to repeated arrests, incarceration, and legal problems. The financial and social costs associated with criminal behavior and incarceration are substantial, affecting not only the individuals with ASPD but also their families and society at large. Health consequences. ASPD is often associated with a range of health issues, including substance abuse disorders, depression, and anxiety. The reckless and impulsive behaviors associated with the disorder can also lead to accidental injuries, self-harm, and an increased risk of violent death. Treatment and management. Treating ASPD is challenging, primarily because individuals with the disorder are often resistant to seeking help and may not recognize the need for treatment. However, various therapeutic approaches and management strategies can help mitigate the symptoms and improve the quality of life for individuals with ASPD. Psychotherapy. Psychotherapy is the cornerstone of treatment for ASPD. Cognitive behavioral therapy, CBT, is particularly effective in addressing the distorted thinking patterns and behaviors associated with the disorder. CBT can help individuals develop healthier coping mechanisms, improve impulse control, and reduce antisocial behaviors. Medication. While there is no specific medication approved for the treatment of ASPD, certain medications can help manage co-occurring conditions, such as depression, anxiety, or impulsive aggression. Antidepressants, mood stabilizers, and antipsychotic medications may be prescribed based on the individual's symptoms and needs. Rehabilitation programs. Rehabilitation programs that focus on improving social skills, vocational training, and substance abuse treatment can be beneficial for individuals with ASPD. These programs aim to provide a structured environment that encourages positive behavior change and social integration. Community support. Community-based support services, such as group therapy, peer support groups, and community mental health services, play a crucial role in the long-term management of ASPD. These services provide ongoing support and resources to help individuals maintain stability and prevent relapse into antisocial behaviors. Conclusion. Antisocial personality disorder is a multifaceted mental health condition that poses significant challenges for individuals, their families, and society. Understanding the diagnostic criteria, underlying causes, and risk factors is essential for developing effective treatment and management strategies. While treating ASPD is complex, a combination of psychotherapy, medication, rehabilitation programs, and community support can help individuals with the disorder lead more fulfilling and productive lives. Addressing the broader social and environmental factors that contribute to the development of ASPD is also crucial in preventing the onset of this disorder and mitigating its impact on society. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.